Coalition's first ever town hall event. My name is Justine. I am a PhD student in Justice Studies in the School of Social Transformation. My co-moderator today is going to be Professor Griffith, who is an associate professor of film media production in the New American Film School. So first and foremost, we do just want to let you know that this event is being recorded and live streamed, just so you have that information. And we're really excited to talk with you all tonight. We really envision this as a true town hall. We're going to share some information with you, but then we also want to hear from you as well. So our organization came together out of a shared feeling of responsibility to oppose the administration's reckless and dangerous decisions and to create a network of people who genuinely care about keeping each other safe, right? So this developed out of the response to COVID-19. We were really concerned about the return to in-person instruction, especially here in Arizona when we were having really high case numbers at that point. And so because we are committed to creating a community of care and a climate in which we do believe that we keep each other safe, we also want to just say that we, along with opposing the return to in-person instruction during a global pandemic, we also stand in solidarity with the Multicultural Solidarity Coalition and their proposal for a community of care at ASU. Their proposal outlines a really comprehensive vision of campus that demonstrates its care for all students, faculty, staff, and community members. This includes things like disarming and defunding the ASU Police Department, making ASU a sanctuary campus, and creating a physical space on campus for marginalized communities. We also would like to encourage everybody to attend the Multicultural Solidarity Coalition's Town Hall, which is next Friday, September 18th from 6 to 8 p.m. And you can follow them on the various social media platforms such as Facebook, Instagram. And again, that is the Multicultural Solidarity Coalition. Great, so we're also gonna have some folks from there speak with us tonight too, so that should be good. So during this event, we want to provide you with an overview of what we have been up to so far. We started organizing in August and we've done quite a bit since then, so we want to share that all with you. We also want to share some information about the COVID-19 data that's coming out of the ASU and why we're a little bit concerned about that data. We also want to create a space in which people can safely share their stories and experiences about how the return to in-person instruction has impacted your daily lives. How is this impacting the way that you study, the way that you work, right? The way that you are living in the dorm rooms, the way that you are living in the surrounding communities. We want to hear those stories. We think those stories are really important because not only do they allow us to see how the university's policies and actions are directly impacting people in their everyday lives, they also provide us with an opportunity to connect with each other across departments, across schools, across roles, all of that kind of stuff, right? And we think that's really important, especially when we're kind of in this moment that is not just a moment, it's also a movement, right? So all of that storytelling really helps us to understand what the climate is actually like for us. So let me think. So first we're gonna propose
for international students, reentry students, people with disabilities. There's a whole gamut of realities that we all live, and we want to think about that. So what's effective and why? What's not effective and why not? What do you recommend? And moving forward, what's needed? So let's see. Justine already said it, that we're really interested in hearing from people who had not felt heard before, as well as people who did not feel safe speaking out. So next we have Dr. Lori Stoff, Honors Fellow in the Barrett's Honors College and affiliate faculty in the Malikian Center. She's going to provide us with a brief history on the ASU Community of Care Coalition. Dr. Stoff.
Thank you, Professor Griffith. So I just want to give you a little background about how this group came together. It pretty much started about after July 27th, when President Crow said that he was sticking with his plans to reopen campus, despite the fact that the numbers of COVID cases in the state of Arizona were still quite high. And we were particularly distraught that ASU's leadership seemed to disregard the state's own pronouncements about what would constitute the conditions for a safe opening. The Arizona Department of Health, as well as the State Superintendent of Public Education, Kathy Hoffman, said that Arizona was not ready for such a reopening and that we should wait until the rate of transmission was much lower. We believed it was reckless, despite all of the promises that made by the ASU administration that it could be done safely. And we were extremely concerned that people's lives would be put in grave danger. We worried that the decisions being made were not taking into account the perspective of faculty and staff, and that the scientifically sound data that was driving those decisions was not being used or is not being used to drive those decisions, since the executive committee that was tasked with the final say did not really include representatives from any of those groups. We were especially concerned that faculty and staff who had requested accommodations to work remotely had been denied, and that there were many others who were pressured either implicitly or explicitly not to apply for such accommodations, or who were just afraid to apply for fear of losing their jobs. We also worried about what this would do to students as well as the greater community, putting them at risk, and especially, as has been demonstrated, disproportionately affecting members of communities of color. So we decided to come together as a group, and we decided on a letter writing strategy. Many of you may have seen that letter, even signed that letter, and we thank you very much for that support. We published this in Medium, and it immediately sort of went viral. President Crow got wind of it. We asked for three things: the postponement of in-person instruction until conditions were deemed safe by the benchmarks established by our own State Department of Health, a granting of accommodations for remote work for all who desired them once we did return to in-person instruction, and for a seat at the table in the decision-making process to be sure that our voices and perspectives were taken into account. The letter garnered over 1,300 signatures, representing various facets of the ASU community, faculty, both tenured, non-tenured, contingent, staff, graduate students, undergraduate students, parents, and other concerned members of our community. And although the letter did not prevent President Crow from pushing ahead with in-person instruction, it did have the effect of getting their attention, forcing them to respond to our concerns. And we did not relent after the publication of the letter. We have a communications team that has released a constant stream of media. There have been nearly 30 unique news appearances, an op-ed, several mentions of the op-ed devoted to our efforts in local and national news sources. Many of our brave members have been interviewed by the press, appeared on radio and TV, bringing significant attention to the cause. And we can see some direct results of that. The administration has been more forthcoming in granting accommodations, increasing the number of those granted from 90 to 95%, although this is still not sufficient, so we continue to push. We push for the release of more data, particularly to ensure that the data being shared is more accurate. And to this end, the administration has been steadily increasing the amount of information despite resistance, creating a website to track and post the numbers of cases. And this week, President Crow finally acquiesced to our demand that the data be more accurately reflected in terms of the rate of infection by calculating the number of positive cases as based on the number of individuals tested rather than the entire population of the ASU community. We have brought undergraduate community assistants into our fold and are pushing for an end to the egregious exploitation of their labor. And we continue to advocate for people, especially those who have no other voice, to provide them with a place where they can safely air their concerns and come together with others so that they can see that they are not alone. This is especially important considering the culture of fear that has been cultivated at ASU, where many feel too vulnerable to speak. On that note, I'd like to turn the conversation over to Dr. Stephan Eichenberry, who MD and PhD, current postdoctoral researcher in the School of Mathematical and Statistical Sciences.
Thank you. Thank you for that introduction. Let me share. I'm in the math department, so I had to create a PowerPoint. Oh, and could you please enable the screen sharing? Sorry, I didn't realize that was off. Great. Here we go. Okay, sorry about that delay there. And allow me to get my pen. Here we go. Okay, so thank you for inviting me to speak about the data that's publicly available. I'll try to make this as brief as possible. And I just wanted to say that in doing this, my position, I'm not a representative of the school or the in terms of these numbers. I'm simply saying that this data is presented in a public forum, and therefore I am trying to understand as a public citizen what can be understood from the publicly available data, what issues, either intentional or unintentional, there are in the presentation of that data, what is missing. And I want to emphasize that most of what I've done here in this presentation is really just arithmetic, and this can be done by anyone. And so as a little bit of background, university reporting in this era of COVID-19 varies widely, from basically nothing to detailed dashboards. And one example of a good dashboard is from the University of Wisconsin at Madison, for example. And so what you're seeing here is a dashboard showing daily time series of total tests. This is this bar, and then the number of those tests that was positive. And so you can see over time as the university opened, both the number of tests went up, but the number of positives went up in greater proportion. And so what we're seeing here is what's called percent positive, which many of you are probably familiar with these numbers. Percent positive is generally defined as simply the number or the fraction over those tests that were administered that are in fact positive. And so this has trended up as well. And what you'll see as well, you don't only get daily data, you also get a 7-day moving average. And then you finally get a cumulative sum saying over the course of all time, there has been some fraction, some total number of tests and some total of come back positive, which is just shy of 1,000 for the University of Wisconsin. And based on this data, they actually suspended classes just several days ago. And so a common theme across most of these dashboards that are of good quality is that we get cumulative tests and positive test result totals. We get this positivity rate or percent positive, which is the fraction of the test returning positive. We get daily time series, and we get these rolling averages that give us a moving picture of what's happening. They take out some of the noise of things moving around, but they also let us know what's happening in basically the last week, because that's generally what's most relevant. This is true across larger scale dashboards as well. This is the Hopkins dashboard, which you may have seen, showing data for Arizona. And we see daily cases. We see Arizona's very large epidemic that is now getting better, but is still not resolved. This is also often visualized as cumulative cases. Cumulative cases is merely the sum since the beginning of time, and it cannot go down by definition unless you're correcting some error. And then finally, so in addition to these cumulative tests, percent positive, we have this idea of positivity rates or percent positive. And again, in Arizona, what we see back toward the beginning of the epidemic till now, what we're seeing here is the total number of tests delivered as this thin line. And then we're seeing this line as the percent positive. And you can see during the height of Arizona's epidemic during the summer, not only did the number of total cases go up, but the percent positive went up. And so percent positive is a general marker for the severity of an epidemic and how well it's being tracked and controlled. It typically goes up in tandem with total cases when things are getting worse. It's since come down, and it's just over 5%. And 5% is typically taken as the cutoff somewhat arbitrarily for a bad epidemic. One more thing, we can also think about things as cases per 100,000 per day. And in Arizona over the last few weeks, this has been around 6 to 7 cases. So these are kind of our basic numbers. Now, ASU has disclosed some data after initially saying it would not. And these have been in a series of text files every few days. Unfortunately, not these nice dashboards of daily data, but we can try to piece some trends together from what we have. And so initially on August 25th, we were told that since August 1st, there had been about 33,000 tests, resulting in 161 results across the ASU community. Several days later, we informed that there were now 37,000 tests, and the number of cases had grown to 452 positive among the student body, with a little less than half of those in isolation on the Tempe campus. Now, the way this was initially reported was 452 total known positives among a student body of 75,000, equaling a 0.6% positivity rate. However, if we do the math here, we're seeing that this is 455 over the total student population. This is not what's typically reported as percent positivity. In fact, if we take, excuse me, yes? Oh, just jump in. Sorry, I can't see the chat with my screen on. Okay, sorry.
Professor Griffith, I think you're muted.
I am muted. An audience member asked if you could speak just a little bit slower. Don't rush it. We're okay. Oh,
sorry. I'm trying to go fast because I know we have testimonials to get to, and I usually, as usual, made more than I should have. So excuse me. So the bottom line here is that what we were having reported was the total test divided by the total student population, and this is not what's classically understood to be a positivity rate. What's understood to be a positivity rate, and this is one of the fundamental parameters, is the fraction of tests that were positive over the total, it's the total tests that were positive over the total tests. And in this case, it was a little over 1% from the beginning of time, essentially. Now, this is also not really the most appropriate way to look at this, because actually what we're most interested in is what's happening in recent time. You know, the university did not open on August 1st, it opened more toward the middle end of August. And so if we just simply do some arithmetic where we say 37,000 and change minus 33,000 about tests, we get that there were 4,420 new tests over this interval. There were 319 new positives. We're just doing arithmetic. And this is the total. This is about across faculty and staff as well as students. And then if we divide those two terms, we say there were 319 positive tests, about 4,400 total tests, we get 7.2%. This is not terrible, but it's above that 5% threshold. And it's of concern. And what's especially of concern is this large increase in absolute cases in general. Now, this is something we're kind of cobbling together from what we're told. It's not this nice dashboard telling us exactly what's going on and giving us a very clear idea of the temporal trends and everything else. So what else can, we don't have that, but what else can we do with what we're told? And now what I'm assuming is that when ASU says the total known positives, that's the cumulative positive results. That's the total known positives. That's how I interpret it. So if we know these total known positives at different intervals, well, we can calculate not only the number of new tests, new cases, and get percent positivity, we can get the new cases per 100,000 per day. Again, we just need the new cases. How many days did it take to get those new cases? And what's our population that we're dividing into? And I'm not going to bore you with like the arithmetic here again, but you get that for the on-campus students, it was my best guess anyway. There's actually a range because you don't know how those initial 161 cases were apportioned, that it's around 400 for the on-campus students, a little under 100 for off-campus students, and a bit over 100 for all the students. And this is compared to AZ's 7-day average of about 7. So what else? So that's, again, this is obviously a much larger rate. We can also say that, well, we almost tripled our cases in 3 days. We can calculate then, therefore, the epidemic is growing with a doubling time of 2 days. This is very large, and we can often see exponential growth early in time. So this is of great concern, and that's why I kind of started looking at this. And it suggests that the effective reproduction number, which is how many new cases you get from an existing case, and if it's greater than 1, your epidemic will grow. If it's less than 1, it will shrink, was also much greater than 1. But epidemics can shift rapidly in time. And you can control things can change very quickly. And so things did seem to change, or at least start to bend quite quickly. So we have these two initial disclosures from ASU over several days. We received 2 new disclosures. These saying going from about 37,000 tests to about 40,000 tests and 775 student positives, and then another 3,000 tests and another about 200 student positives. So we're seeing, increasing number of tests, increasing positives, and we can simply do the same arithmetic exercise we did before to say, well, how many new cases were there? How many new tests were there? What's that percent positive? How many is this per day? How many is it per 100,000? We're just doing very simple arithmetic on the data that's been disclosed. And if we do that, we can infer some things. These stars are just kind of these disclosures, and we can kind of just guess what was in between. We don't exactly know, but we're trying to come up with some kind of time series that corresponds with what we really want. We really want the daily time series so we can have a very clear picture. We don't have that. We'll get as close as we can. So we can see that the cumulative cases is rising. We can interpolate, we can infer that the daily cases are something like this. They were low, they went up really high, and then they came back down a little bit. And we can infer that per 100,000 per day, well, our cases were low, went up, and again, have come down. And again, they have come down, but again, are still elevated compared to the Arizona average. Now, this was data up to September 3rd. Now, what happened and we can also infer an overall percent positive, which again, over 5%, going up a little bit, coming down a little bit. So again, suggesting things getting bad, maybe still bad, but not as bad, or getting better. But then we get another update, and we get that there were some increase in tests, but the students' positives went down. Well, by definition, the total number or cumulative number of cases cannot go down. So clearly, this is not, in fact, the cumulative cases. And our previous conclusions aren't really reliable because we don't really know what it is. And it implies, and this is then confirmed, apparently, that what was being used is active cases, some kind of version of active cases. People get sick and then they get better. And so you're counting up the people who are actively sick. Now, this is relevant, obviously, to an epidemic, but this is a less common way to report this idea. It's inconsistently reported across health departments. It's not what's really standard. And without this cumulative case data, we can't really calculate any of these other parameters or know how things are evolving. This is not something that's irrelevant, but it's an ancillary measure in most reporting. So, again, so fortunately, cumulative cases now have actually been added. And in September 9th, we were told that there were about 1,300 cumulative student cases from August 1st. Now, it's unclear if that was to September 7th because it was added to the document updated September 7th, or if it was September 9th. Then on September 10th, we got another 80 and changed cases. And again, we're not distinguishing between on and off campus populations. We don't know what these cumulative cases in the past were, so we're lacking a lot of detail. But from there, again, we can confer that maybe the overall positivity rate has gone down, and we're somewhere in the neighborhood of maybe 30 to 100 student cases per 100,000, but we don't really know how many days this was over. So this is still much worse than the Arizona average, possibly getting better. So things are getting better, but they're still high. So that's kind of the overall story, and I don't want to take too much more time here. I just want to give the big picture, but just I'll say real quickly, if we compare this to the state level data, the trends we've seen in the state, well, we had this huge epidemic in the summer, it came down, and then in the last 2 weeks, we've had a 15 to 20% bump. And if we actually just do arithmetic and add up the numbers, we know that there were at least 1,224 new student cases over that interval. There were about 8,300 new Arizona cases. And so that means that ASU students were about 15% of new cases across Arizona. And even though they make up only about 1% of the Arizona population. And we can also see this in zip code data that's reported by the state. We can see 85281, which is the main zip code for ASU. Here's 85282, which is just south of ASU. And we can see again, this is daily cases, basically since May. Tempe, these ASU zip codes were not terribly different from anywhere else, and they had these really big spikes in the last few days. Now, this is just the raw data. If we smooth it out with a moving average, which is typical, we still see this same trend. We see a big surge, we see things coming down, and now, we're kind of here. We'll see how things go, but that's where we are right now. And that's what we can kind of piece together from what is available through ASU, what is available through these public sources. And this is also just showing you, your cumulative cases. Your cumulative cases never go down, and we had big increase in the cumulative cases here. There are some increases elsewhere too, but this is a big thing. So I think in the interest of time, I'll simply skip this, just to mention that the effective reproduction number, which is a measure of how much disease is spreading, has in fact gone over 1, or is estimated now to be over 1, this is a threshold quantity, and we want it below 1. It's now over 1. And this may be related to some of the dynamics in Tempe and at ASU. But in the interest of time, I'll skip that and just say, broadly speaking, the conclusions on the data that we have from ASU and in conjunction with what we have available through the state is that the reporting from ASU is improving. We have these cumulative totals now, but they're being overwritten, in fact, in updates. We can't really infer anything in the past. We don't really know what happened in the past. We don't have daily testing. We don't know what the actual positivity rates. We don't know what the time series of this is, and we don't really know how these people now are truly divided between the on and off campus populations, at least from what I can see from what's publicly available. And our overall conclusion is that these ASU reports, again, they have gotten better, but they have not, at least at all times, conformed with standard definitions and reporting practices. This was not clarified typically in the text of the reports. As I said, improving in steps, but still gaps. The epidemiologic picture is overall improving, but our case rates are still high. We clearly had a large initial surge that may or may not, is resolving to some degree, but we don't really know where things are. ASU has been a major factor in the recent Arizona epidemic, and other universities have in fact provided detailed daily data with detailed data even on specific dorms and fraternities, infection rates and things like that. And so I would simply ask, can we please have something like what they have at the University of Wisconsin-Madison and many other universities that gives us a complete picture. So I don't have to sit here and try to explain all this arithmetic and piece things together, and we can just see what's going on, and then we can make decisions. And it doesn't mean things are good or bad, it's just we all want to know what's going on so everyone can be part of the decision-making process that affects their lives in a democratic manner. And I'm sorry if I went over a little bit on time, and I'd be happy to take any questions later. Thank you.
Thank you very much, Dr. Eikenberry. Thank you very much. So we're doing okay. We're just a little bit teeny bit behind schedule, but that's to be expected, and it's important to get that information out because it's not been clear. So at this point, we have our testimonies. So we would like to ask our colleagues that have agreed to read the anonymous testimonies to perhaps start with one of those. And then when people are doing their live testimonies, we ask that you try to keep it to 2 to 3 minutes each. And Justine or I will come in and we'll just say 1 minute, 2 minutes, 3 minutes, sorry, that's all we have time for. So it's no disrespect, we want to hear from as many people as possible.
Yes, thank you so much for that, Professor Griffith. I do want to hand over the first testimonial to Miriam, who is with the Multicultural Solidarity Coalition. And then from there, we'll read one of the anonymous ones, and then we will open the floor to anybody watching that would like to share as well. And we'll just kind of take it from there. So Miriam, if we can hear from you, that would be fantastic.
Hi, it's good to be here. It's good to see everyone. So I'll just kind of go into our introduction about MSC here. So the Multicultural Solidarity Coalition has been a Black, Femme, and Queer of Color-led grassroots effort for the past 4 years at Arizona State University. Its goal was to create a multicultural center in which we received much pushback from various deans, professors, and President Crow himself. President Crow stated that the vision for the MSC was not a part of the New American University. The current proposal that we have now is a fully developed document outlining all of the resources students of color and other marginalized students are requesting that the university implement. So this includes the Cultural Excellence in Scholars Program that would be housed in the Multicultural Center. This includes the Rape Crisis Center. This includes Queer and Trans Center. This includes the Muslim Prayer Center and a Community Learning Fellowship, just to name a few of those. So one of the things that we feel is very important about this document and our proposal is that it was created by students who are directly impacted by the violence that leads to low retention rates. And it was written by those students who need the most help gaining an equitable education. So the students who wrote the proposal from MSC are comprised of Black students, these are female students, these are queer and gender loving students, these are trans students, undocumented students, formerly incarcerated students, differently abled students, and Native students. And we believe since we are the students who are closest to the problems that are happening on campus, that we are closest to the solutions and that our voices deserve to be heard. So just kind of an update now about where we are. So Crow recently released a 25-point plan, and we are currently attempting to participate in conversations between Crow and the Council of Coalitions and about the newly improved, about the building, the Multicultural Center building. However, Crow has still not directly communicated with us. We are currently being alienated from the implementation of our own proposal. So the 25-point plan was basically just kind of copied and pasted into proposed 25 points, and there was also language in there that kind of misconstrued some of our messaging. So basically Crow and his cronies have co-opted our proposal and have not reached out to have any discussion with us about it. And we have been texting Dr. Rund, that is the Senior Vice President of Educational Outreach and Student Services, to ensure that we get a meeting with Crow. However, we still have not received confirmation of this. So we feel like our continual silencing is what did lead to our march. And that march was from Daly Park to ASU PD, and then to the ASU charter to demand that ASU administration and President Crow actually hear us and demand to be heard. Again, just to be listened to, because right now that's not happening. So we do also, as a coalition of marginalized students, we recognize that and professors and administrators, and there's also alum in the coalition as well. And most of them, all of us, are directly impacted by these kinds of violences that I was stating earlier. So we do recognize that the strongest defense of those in power is silence. And that's what we have been receiving from the ASU administration, is their silence. So this is just kind of where we're at now, still wavering in the midst of this silence and feeling very disheartened by being able to actually get the things that we want implemented. And but again, some of the language being stolen from the labor that we have produced. So we would also describe that as theft. So I will go ahead and pass this to kind of Lexi, and she'll kind of give you some more feedback about where we see this coming from as far as the structures of the university and how we're not too surprised by some of the things that are occurring now.
Thank you, Miriam. I was not being a very good timekeeper. So Lexi, if you could keep it closer to 2 minutes, if you could, so that we can have more time for people to have maximum participation. But the first couple testimonies always take a little bit longer. We get better as we go along.
Yeah, I don't have much to say, but I just kind of want to talk about how, we're here today talking about maybe the shockingness or the dishearteningness of Crow's administration's dealing with the virus. And we kind of want to provide the perspective that actually we're not shocked by this and his behavior. And it's actually worse than people may immediately think. And so we want to talk just briefly about the structure of the university and why it's not surprising the sort of egregious responses that we've been witnessing. So we see ASU as a set of businesses whose primary objective is to increase profit by increasing exploitation. So we see also the university as a part of structural and institutional violence. And these are words that get thrown around a lot, and we're not just using them as empty signifiers. So I just want to hint to something that Fred Moten and Stefano Harney said: the institution is regulatory and regulation tends toward elimination. The university regulates certain kinds of theoretical and empirical, intellectual and sensual study. The prison regulates mobility. The hospital regulates health. The state, of which these other institutions are apparatuses, regulates sociality in general. So the university is not a neutral site of education. It is a valuable constituent part of the reproduction of the social order, which includes the regimes of colonialism, anti-Black violence, and heteropatriarchy. And we've been met with violence and rejection since this effort started 4 years ago. So Crow's response, or lack thereof, is not surprising to us, but reflective of his past stance towards us and the historical relationship between university administrators and marginalized underlings of the university. So we are at MSC an abolitionist organization, which means we are fundamentally interested in confronting and transforming the carceral logic that governs the world. We're actually having a town hall a week from today to talk more about all this stuff from 6 to 7:30 p.m. And if you're interested in getting involved in our efforts or helping us out, feel free to reach out to our email, mcssolidarityco@gmail.com, or look us up on Facebook or Instagram, where we have a 10-point plan of action items that you can start taking right now. Thank you.
Thank you very much. So Justine, where are we going next?
Yes, great. Thank you so much. I want to thank the Multicultural Solidarity Coalition for sharing their stories with us. We think that's really valuable. And we also agree that creating a community of care starts with the most marginalized of us, right? Again, like Miriam said, right, those closest to the harm are closest to the solution. And so these are the voices we need to be hearing from, which leads us perfectly into our next testimonial, actually. So this is one of the testimonials we received that is anonymous. And again, I want to emphasize we're receiving these anonymous testimonies because there is a climate of fear across the university right now in which people are afraid to speak out because they are afraid to be retaliated against. And so I'm just going to go ahead and jump into this. So this is a testimonial we received from a community assistant at ASU, at ASU's Barrett College. So this person says that they are very grateful for everyone taking the time to listen to their experiences tonight. They believe that this is an incredibly valuable opportunity for our community to advocate for one another and create visible change. Their first concerns are the obligations that housing is placing on them as community assistants during COVID. So to be clear, community assistants are undergraduate workers, and these are folks that work in housing specifically. There's been a lack of measures to protect students in housing, both the working students as well as those who live there. This person took this position again because they believed the school was doing the very best it could to protect them and the students who absolutely need housing during the school year. So they say, well before school started, my coworkers and I developed a comprehensive document of campus-wide concerns from community assistants. And the response from our supervisors was was that nothing would change. They are expecting us to be constantly giving our time and attention to this job without making our job safer. Throughout CA training between July 30th and August 19th, we continue to provide our concerns as well as solutions to our direct supervisors, and more importantly to upper housing. Each time these concerns, including physical contact with residents, resident hall guest policies, dining hall, mask and social distance enforcement, COVID parties, etc., were blatantly ignored and our safety made incredibly trivial. The upper housing staff made these decisions, making these decisions also never come into direct contact with residents experience the daily lives in residence halls. They do not have to deal with the angry parents during move-in or face direct consequences, such as contracting COVID from their actions. Throughout the opening of the university this year, CAs have not been included in creating housing policies. Most importantly, it compromises my own physical health to be expected to break up massive gatherings with anyone from 10 to 100 plus students, and with only myself and one other community assistant. All of these guest policies, all of which we've only heard about indirectly, have no distinction between students participating in massive gatherings and COVID parties and students having a singular friend over. Basically, students who are in desperate need of human contact and connection. My residents are depressed, anxious, and disconnected, and it hurts my heart to see them struggle like this. Regarding day-to-day happenings at Barrett Complex, none of the claims ASU makes about COVID policies are true. Social distancing doesn't happen, students don't wear masks when they should, and PPE sanitation products are not readily available to employees. The upper housing staff and ASU leaders are not the people on the ground seeing these things happen in real time, and they also do not care about what we tell them in any way. If you were curious about how much community assistants are compensated, here's the general breakdown. According to our contract, we are supposed to work 20 hours a week and not more than 5 additional hours at any other US position. If I was working 20 hours a week and you factored in fee in our free room and board and the stipend we receive, the average hourly wage of a CA is $18.42 per hour, which sounds wonderful for a college student. In reality, community assistants truly work much more than that. If you count the number of hours we worked during the 14 days of move-in this year, the additional hours we are now required to work without pay at the front desk, and all the extra time we spend consoling our residents. ASU community assistants make $9.33 per hour, roughly half of what we make on paper. This is first of all below the minimum wage of $11 per hour in the state of Arizona, which might be up to 12 now, but either way, still below minimum wage. And secondly, not nearly enough compensation to justify constantly exposing ourselves to COVID-19. I'm amazed by the exploitation of our hard work, and I struggle every day handling this job while keeping myself safe. So that is a story that we've heard from a community assistant. At this time, I also want to open it up to anybody in the audience who would like to speak. I want to strongly and sincerely thank the community assistant who shared this story. We know it's a little bit scary sometimes to stand up and speak out, but we really appreciate this. If anybody in the audience would like to speak, please use the raise your hand function, and then we will call on you next.
And then the way that it works is it goes in the order of the order received. I also wanted to remind us at the time, we are at 6:40, almost 6:45. So we have approximately 15 minutes left. Time does fly. We will try to hear as many people as possible. And don't forget that we have the Google Docs form. So people, this is an ongoing conversation. So this is just a beginning. The Google Docs has an opportunity for this conversation to keep going, and we can perhaps we might have to just schedule another town hall, but we have lots of ways to hear from you besides just here.
Should I read the next testimonies?
I'm not seeing any hands right now. So I'm going to say, yes, go ahead, read the next testimony.
This is from another community resident assistant. This person is on the Tempe campus. And again, they want to remain anonymous because they are afraid of retaliation. I love my job. I love facilitating connections between students and helping them to integrate into the campus culture. That's during a normal year. During COVID, I'm in a constant state of fear. Though students gather on the squad used to bring me joy, I now see it as yet another opportunity for COVID-19 to spread. I want these freshmen to have a great year, especially given all of their senior year's moment in high school that they lost. However, as I see COVID cases on campus rise, I worry that by continuing in my job as if nothing is wrong, I'm indirectly jeopardizing residents' health. Sharing those concerns may shatter the idyllic freshman's experience they are trying to find, but I don't want it to tumble on, even though the university does nothing to notify me. I want to make sure that they can make informed decisions about what's best for their health. Do they feel safe and well enough to remain on campus, or do they have alternate housing options? COVID-19 is making pre-existing university transparency issues more apparent. FIPRA has always made communication challenging, but add conservative interpretations of HIPAA onto that, and the flow of information come to a screeching halt. I want residents to make informed decisions based on the trend of cases on campus, their risk factors, and what alternative housing options are available to them. I worry that ASU is intentionally restricted in their publicizing data out of its financial interest in opening campus rather than for the purported concerns for student privacy. Housing's lack of clear policies has also impeded our ability to actually enforce any changes, therefore preventing any meaningful response to outbreak on campus. As infected residents are moved into isolation, rooms on floors with healthy students, we have no way of knowing if someone is COVID positive when we knock on their door for a noise or alcohol violation. There's no way for us to enforce mask policies outside of the dorms themselves. There's no way for us to know who is supposed to be isolating in their rooms, and thereby no way to write someone up for violating quarantine. Whenever we enter a room and enforce policies, we are taking major exposure risk. I have busted parties and rooms in the dorms with over a dozen maskless people. They're frequently non-cooperative when we ask them to wear masks, and often insist on hiding, thus increasing the amount of time we are forced to expose ourselves in the room. I also have to work at the front desk and interact with my own residents, meaning that any exposure I experience during duty work also jeopardizes anyone else that I have to interact with as part of my job. COVID positive residents are also frequently coming to the front desk when they are moved to our community due to lock issues or any miscommunication from housing, forcing us to interact with those we know are positive. Cuts this down as much as you need. So we didn't cut anything, we read everything, because there you go. That's the kind of testimonies we're getting.
Thank you so much for reading that, Professor Kwan. Again, I want to open it up. If there is anybody in the audience who would like to share a story, please go ahead and raise your hand by clicking on the participants icon on Zoom. I'll give it just a moment. All right, I don't see any hands, so I'm going to move on to the next testimony that we received. And again, this one is anonymous as well. So this person says, I work for classroom support under the University Technology Office. My partner at home is high risk, so I requested to stay working remotely when school started. It was denied, so I'm back on campus. On top of the stress of avoiding COVID is the stress of supporting all the new Zoom technology that ASU hastily had installed in the weeks leading up to the fall semester. Quite frankly, ASU bit off more than it could chew with all of these upgrades, and it has made my job more stressful than it has ever been. Instructors are understandably frustrated with the new technology because they do not know how to properly operate it, or there are issues with it that cause them to lose teaching time. And many of them take out their frustrations on me. I've been berated and belittled by several instructors. I feel like a punching bag. Some instructors take out their frustrations with leadership's decisions out on me when I neither participated or agreed with said decisions. The stress and constant threat of COVID exposure on a daily basis fills me with anxiety, and I feel quite used by ASU's leadership. So these are a little heavy, obviously, right? So I do just want to ask us to take time to sit with what people are telling us right now, what the stories are that they're sharing with us. ASU did put out this campaign that they were going to be a community of care, but what we're hearing right now is that people do not feel cared for. This is one of the reasons that we're hoping for more shared decision making, because it's how do you make decisions about people without including those people in those decisions?
I just wanted to bring up one point about the notions of HIPAA violations and caring for students that have to be in isolation. So I received a note from one of my colleagues that a student tested positive, self-identified, and was doing fine and was in isolation. But the question is, if the CAs don't know if somebody is positive, how can they check on them and make sure they're okay? It's just that simple. So that's concerning. So I would like to hear some information from the administration in terms of what they're doing besides just having a person check in on their smartphone and say my temperature is X, Y, and Z, because you can have a fever. There's things that you have to do. You know what it's like when you have a regular flu. You have to take care of people. So that's concerning.
So what I'm going to do, just for the sake of time, is if at any point during this testimony you want to speak, just raise your hand. If we don't see those, we're just going to keep on going with the ones that we received. So Professor Kwan, do you want to read the next one?
Sure. After I was granted an accommodation to teach remotely this semester, a wave of relief washed over me, but that feeling lasted only a few seconds because not all my friends and colleagues at ASU have experienced the same level of institutional protection of care. My reason for signing ASU C3 open letter last month was therefore very straightforward: solidarity.
Which we're very grateful for. Solidarity is kind of really important during these moments, right? Okay, so the next one we've received then, this one says, I came to live on campus as a freshman, optimistic that protocols would be in place to keep me safe. I've since been let down. Maskless slippy slides on the Barrett front lawn in the view of ASU police officer and the humongous non-physically distanced lines for, ironically enough, COVID-19 test drop-offs at ASU has had me reconsidering my decision to live here. My own suite mate contracted COVID-19, and I had no idea until she told me 3 days after her positive results came back and was quarantining off campus. No one told me that I had been exposed directly or to clean the bathroom or any such protocol. She assumed that ASU would tell me that I've been in close contact with someone who tested positive, but they didn't. I was left unaware, and ASU did not care.
Hello, everyone. I am a community assistant at Arizona State on the Tempe campus. Thank you for giving me the opportunity to speak to you tonight. I have been upset about ASU's decision to do in-person classes and dorming this semester since I first heard about it. I'm from out of state, and I cannot describe to you how afraid I was to come to Arizona when the state was on the news for weeks due to COVID spikes here. In addition, I was very skeptical of ASU's supposed plans to prevent COVID from spreading on campus when all I heard was forks up, masks up. Unfortunately, my bosses made it very clear that if I did not come to campus, I would not be hired and I would probably never get the opportunity to be a community assistant again. I came because I can barely afford this university even with this job. So without it, it would have been impossible. I also came because before all of this, I was excited to be a community assistant. Many of the community assistants on campus are in vulnerable financial situations, which is why they are manipulated and taken advantage of, especially the semesters. Since I have been here, we have been overlooked and underpaid, and many of the hours that we work includes interacting with students who have the coronavirus. I could talk for hours about all of the horrible things that I have witnessed since I have been here. However, I have chosen to speak just about one personal experience that I think illustrate ASU's lies and lack of care for the health of their students here. This was one of the breaking points for me. During the first week of school, my co-community assistant and I decided to host a floor dinner because we heard that some of the residents on our floor had been feeling lonely. We sat socially distanced and ate, laughed, and talked together. The next day, one of the girls who had attended the floor dinner texted me to tell me she had tested positive for COVID. This was a surreal feeling. I had seen her in person, sitting across the elevator lobby from me just 15 hours prior. She had been surrounded by my and other people from my floor that I love. My co-CA and I were scared. We were not allowed to tell the other residents on the floor that they had been exposed because ASU's irrational definition of HIPAA. I called my boss about this and he had nothing to say. Let me say it again. Everybody who had come to the floor dinner the night before had been exposed to COVID, but ASU did not allow me to tell them. These students were going about their social lives without knowing that they could be carrying a deadly virus. I knew, but if I told them, I could be fired. It gets worse. About 5 hours after I heard she had tested positive, the girl texted me again asking why she has still not been moved to isolation dorms. For reference, this student lived in a share room, share bathroom dorm. This means that she had a roommate and 2 suitemates constantly around her. ASU had promised that when a student tests positive for COVID, they would be moved to isolation dorm. So I was furious and that she was still in her dorm space with no instruction for upper housing. Her roommate and suitemates were all panicking and afraid to return to their dorm because of COVID positive resident was in there. I made some calls. My boss was unwilling to help and seemed unfazed by the fact that this person was still in there with other healthy residents. He said, "We will deal with this in the morning." I called a community director on duty, who seemed surprised that this student was expected to be moved into isolation. She informed me that the isolation dorm are full and no longer taking students. Remember, this was during the first week of school. This COVID positive resident would have to continue to live in the same room as her healthy roommate. I was shocked by the lack of care from people above me. The community assistants were the only people who care about the health and safety of these residents and were willing to help. I also could not believe the blatant lies that ASU is telling the parents and students. Isolation dorms are myths. Effective protocol is a myth. The same night, other CAs that I knew had COVID positive residents moving into their hallways. I was baffled by the fact that some residents who tested positive were unable to move rooms, while others were moving into healthy communities. It seems like ASU was doing the most to make sure everybody, everywhere, was unsafe. The COVID positive resident ended up leaving ASU on her own because ASU did nothing to support her or move her to a new dorm. Meanwhile, my co-CA and I had still been exposed to COVID, so we decided to take a test and isolate ourselves. My co-called health services to ask what to do when he was exposed to COVID. They told him that he was still allowed to leave his dorm as long as he wore his mask. This is the message ASU Health Services is giving to every person who is exposed to COVID. No wonder they are walking around campus everywhere, getting everybody else sick. My co and I told our residents we were exposed to COVID and were beginning a quarantine. It was extremely frustrating that we were not able to tell them that they had been exposed as well, but we were hoping they would catch the drift and go get tested.
Dr. Kwan, I'm so sorry. I just wanted to let you know that we are at time, but we're going to run a little bit over. So people, we have 2 more
I'm
testimonies.
almost done. Yeah.
We have 2 more testimonies after this. So folks, we might run till about 7:15. Just wanted to let people know.
Okay, thanks. I'm almost done. I'll read faster. Instead, they decided to go on a group hike. It has taken a few weeks for residents to realize what is going on here. My co and I wanted to be as transparent as possible and constantly hint to them that people are sick and that they should move out if they want to stay safe. I'm sure my boss would be upset about how much we have told them, but we still don't feel like it is enough. Some of them have decided to leave. Some of them still don't wear their masks, when they hang out with each other. It is shocking and scary. I will never forget the first week of school where I panicked often because I felt like my hallway was breeding ground for the coronavirus and I was sure somebody I love was going to die. However, as time has passed, I feel that I have numb a bit to this feeling. The building that I live in is filled with COVID, as well as the residential community I'm a part of. One of my favorite people I know at ASU has tested positive now, which was what I fear most. I only worry about what I will witness as I continue to live here. It seems that it always gets worse. As the weeks have gone by, I have watched freshmen that I know and love slowly realize that ASU lied to them and continue to lie to them. I have seen them move their things in and then move them out because they feel unsafe. I have watched these same students being exposed to COVID, but unable to tell them that they may be sick because my job would be threatened if I do so. I have seen residents get sick and been unable to do anything to help them. I have also seen piles of food outside residents' door, not knowing who lives there or if they are even alive. Nobody is checking in on them because nobody knows who they are. I wonder about why CAs are so out of the loop, why we do not know when COVID positive residents have moved onto our floor, who they are or how to help them. Above all, I have witnessed ASU blatantly disregard the lives and safety of their students and their workers time and time again. They have been lying to students on campus, making empty promises and refusing to inform them when people around them are sick. I am mostly upset that I'm witnessing horrible things and I'm not allowed to tell anybody. I wish the whole world could see what is going on here. Maybe then President Crow would stop. Thank you for listening and for your solidarity. We have all been hurt by this university, whether we realize it or not. May we all work toward a positive change together.
Thank you for sharing that, Dr. Kwan. We have, Justine, we have two more, correct?
Yeah, they're pretty short, so it shouldn't take too much longer. And we appreciate everybody sticking around. We do want to give you an opportunity to ask questions as well. We also feel these stories are really important and they were entrusted to us, so we want to share them with you. So this one says, as a lead community assistant, I'm appalled by the poor treatment of my coworkers throughout training and during this school year. Management in university housing had planned poorly for the opening of the dorms this year and has had numerous opportunities since March, when this year's CAs were hired, to ask for feedback from CAs and CDs. I'm sorry, I'm not sure what CDs stands for, but hopefully other folks do, who are on the ground. Working with students every day, we are frequently exposed to COVID-19 at work and threatened with being fired if we don't accept these conditions. Furthermore, university housing is not adequately protecting students from COVID-19 or supporting their needs if they do test positive.
Dr. Kwan, you have the last one, correct?
This is the last one. CA across ASU are experiencing significant amount of overwork and short staffing. I personally work 70 hours a week during move-in, decreasing to 40 to 50 hours a week once class started. This job is coded for 20 hours a week. Our contacts were changed to add 5 hours of working at the front desk in addition to all of our previous commitment from prior years. So 20 plus 5 does not equal 20. I'm constantly asked to interact with students in person, work the front desk, and knock on doors on duty, not knowing whether students are positive. I'm also responsible for twice the residents I should be. We are short 7 CAs and 1 CD in Barrett. Other communities are even more short-staffed. Adelphi and Sonora don't have a CD at all. As staff resigns, the issues of short staffing will become worse over time. We become responsible for covering desk shifts, duty, and taking on additional residents. CAs have gotten sick from being in duty situations. Staff are constantly rotating in and out of quarantine due to potential exposure. We are also not included in any contact tracing that is done for students. We are overworked, asked to put ourselves at risk, and fear for speaking out because many of us don't have anywhere else we can go to live if we were to lose our jobs. And that's the last testimonies.
Justine, you received one more. Someone asked if you could check the Google Docs. They have a story that they'd like to share there.
Let me see. Yes, I will do that right now. Let me refresh it.
So as she's doing that, folks, please think about using the Google Docs to, again, tell us what's effective and why, what's not effective and why not, what do you recommend moving forward, what's needed. We've received a lot of testimony here from the CAs, and it's collaborative. It's not random. We're hearing multiple, there's a pattern here. So this is something that if there's anybody out there in administration, and we forgot to ask at the beginning if there's any press people here, to please let us know that you're here and to see if we can help follow up and amplify these voices.
Alrighty, so I'm not seeing the additional story on the Google form, so I'm not sure what to do.
I think at this point, somebody asked in the Q&A if we have the sound disabled for participants. Let's just open it up. Just open up the audio and have everybody have an opportunity to speak.
I think it probably makes sense for folks to use the hand raise button, and then I will know that they are trying to talk.
Great.
If that's okay, folks.
Sure.
It is maybe worth pointing out as well while we're waiting that generally speaking, universities take a overly broad interpretation of HIPAA and FERPA. That's at least the opinion of some. HIPAA covered entities are generally healthcare providers, and a university can be a healthcare provider. It does provide these services, but that doesn't mean that everyone who works, I don't want to say legal advice, but HIPAA only really applies to healthcare providers, and those are the only HIPAA covered entities. This is not a general law that says as an individual, you can't tell someone about your own health status or someone's health status that you know. You may restrict you from doing this if you're acting in the capacity of working for a HIPAA covered entity, which can include a university. FERPA is also generally interpreted overly broadly, and the Attorney General has stated that basically transparency should be the default, and there's nothing in FERPA that prohibits universities from publishing detailed data, including dorms. You're not allowed to include identifying information, but the standard is not could Sherlock Holmes ever discover possibly in some world who is actually positive. It's whether or not you're taking reasonable steps to protect privacy. It's not, is it possible in any universe if someone really wanted to do this. That's not the standard, generally speaking, for disclosing data.
There's also, I know, in terms of, if there's physical abuse, sexual harassment, there's a duty to report. This is a global pandemic, and the short-term, long-term health implications are serious, even for a mild case of COVID. In this particular context, with the danger of community spread, it seems like it would be a duty to report. Once again,
there are exceptions, including explicitly epidemics or pandemics.
Oh, of course, bien sûr. So we are a bit over. I just wanted to make sure that everyone had an opportunity to speak if they didn't want to speak. It's okay, we'll just wait just a moment longer. Anybody need to say anything? Okay. I want to thank everyone for participating and for hearing these voices and for just giving a time and attention to these very serious concerns and hopefully some possible solutions. What we've heard is we need to listen to the CAs. We need to listen to the students from the Multicultural Solidarity Commission. We need to listen to the ASU Community of Care Coalition when we ask for more clearer data and more transparency and more involvement in shared governance, because these issues affect everyone. As we leave, my colleagues asked several questions, and I'm just going to hit them, and maybe Justine, you can share them with me as well. So one of the things that we wanted to say is that we support and want to amplify the university student graduate USGTs. Is that graduate student TAs, Justine?
I think it's the Graduate Student Associate Government.
Okay, to close in-person classes. We stand in solidarity with the Multicultural Solidarity Coalition and their proposal, which outlines a comprehensive vision of a campus that demonstrates its care for all students, faculty, staff, and community members. This includes disarming and defunding the police department, making ASU a sanctuary campus, and creating a physical space on campus for marginalized communities. We encourage everyone who believes in a true community of care to sign their proposal and support their work, and to attend their town hall and teach-in, which will be this September 18th from 6 to 8 p.m. And then finally, we demand full transparency from ASU administration regarding the data that they are gathering and how they are using it to make decisions about housing, classes, accommodations, and remote work. We are, as we said in our letter, ASU can and has a tremendous expertise to teach remotely. We have that. We pivoted so quickly in March of last year, and it wasn't ideal, but we did it to the best of our ability. The situation is such that we've got to pay attention, particularly what's going on in these dorms with these freshmen and these and our community assistants. I'm rambling, but I just wanted to just share that we need to listen more and take care of people. Justine, is there anything else?
Two comments real quick. I apologize.
Oh, please.
So one, it was the undergraduate student government that voted, which is a huge body, right? Represents a lot of people. They voted for that. And then I also want to make a slight correction to my statements where we did release the letter slightly early, sort of unintentionally, and Crow did get wind of it, but we also sent it to him directly, and he denies that we tried to engage him directly, and he continues to deny that.
There was something, where'd it go? Somebody posted, an anonymous attendee posted in the Q&A too, that they're really concerned about the undergraduates and freshmen in particular, and that they're, wondering like what kind of accountability there is, these types of things like that, right? Like how are the undergraduates being treated? What are they supposed to do, if they're not being given accurate information about COVID and about who's been exposed and all of those kind of things too. We also have a question here. Where did it go? Oh, no, I lost it. Sorry. Technology and I are becoming new friends, so bear with me. Yeah, I think one of the things, there's a really interesting question here. It says an anonymous attendee asks if there's strikes within the works. We've been seeing strikes across universities right now. I think one of the things that we want to keep doing is being a space for people to come and share their stories. And again, like we said, storytelling is a great way to connect. It's a powerful way for us to see that, hey, we've been, working in these individual departments, these individual schools, but the problems that we're facing are shared. They're not isolated based on school, department, et cetera, right? And so I think, I don't know what's coming next. And, never want to try to predict the future too much, right? Because you don't want to overdetermine things. But, one of the things that we're going to continue to do is share stories from folks. We're going to collect stories from people and create a safe space for people to share those stories. So I want to encourage people to continue watching our social media platforms, our Twitter and Instagram that are at the at sign ASU_C3, and Facebook, which is at ASUCCC. You can also email us at ASU.community of, well, hold on, there's a lot of dots in there. Let me start over. So the email address is asu.community.of.care@gmail.com. So that's another way to get a hold of us. And yeah, keep watching our social media platforms, because we're going to have next steps coming up for you here soon, and a way for student workers, graduate student workers, faculty, and contingent faculty, for staff. We really want to hear from staff what your experiences are. We're going to have opportunities for you all to keep sharing your stories, and from those we'll see what emerges, right? You know, again, this is a movement. Like, all of this is a movement. We are in really interesting times, to say the least, and you know, there's a lot of stuff that challenges that we're facing, but there's a lot of hope in the movement work that everybody is doing too.
And we are here as a body of people who do care, and we're getting in good trouble, because it's worth it. It's really worth it. So, and some people are more able to do that. And so we would really invite some people that can take some risk and stick their neck out a little bit more to please join us and help us amplify voices. Dr. Kwan.
Oh, I just want to say that someone reminded us that we need to thank the media, particularly the local media and our student journalists, who have been doing an incredible job covering the story and paying attention to the rates of positivity on campus. The Arizona State Press rocks, man.
And I do see that we actually have somebody who is brave and raised their hand, so we appreciate that. I'm just going to, I think I just have to ask to unmute, and then Jeff, it looks like you should be able to share with us.
Hi, can you hear me?
Yes. So
I'm a professor in the School of Music, Dance, and Theater. And listening to this, I just want to kind of try to remind folks that stories are really important. I'm older. I'm in my 60s, and I lived in New York in the 80s and 90s. And when it came to AIDS, there was a lot of data. There was a lot of scientific data, but it became very important and it was interesting when it was a lot of women saying, yes, but our symptoms are this. This is what we're going through. These are our stories. And it actually changed the way that AIDS and HIV were diagnosed. And so stories are really extremely important. And I'm a theater guy, so I care about this stuff. But data, we are dealing with Michael Crow. Is a data-driven guy. He was hired, he and I were hired around the same time, around 2001. And he's a very data-driven person. We are in Arizona, a very, very regressive state. They hired Michael Crow, who I still believe is actually a very progressive person. But all of these stories that contrast and push up against the data are critically important that upper administration hears. Because data can lie, statistics can lie, but it's really important that all of the things I've heard today get back at that push back at this is what we are actually experiencing. And I still think, and I'm a professor, I'm a very privileged guy, but I wasn't when I came here. So I understand what it is to feel like you're not being listened to. But I think the more that we give these stories and the personal data, the embodied data that we have to the upper administration, I think they will begin to listen. But it's going to take a lot of work, and I really admire my colleagues who have worked a lot harder than I have on this. So I just want to say that this COVID is one thing. With HIV, I lived through this. It's the more that you can not personalize it, but give a story, give a narrative, give a fact, a data on the ground, the stronger our case will be.
Thank you, Dr. McMahon. So I think unless there's anything else, let's just call this the end of this particular moment. It's a movement. We'll continue gathering stories, and we'll continue advocating for people who need that. And again, I just wanted to invite people in the press and the media, our staff, our contingent workers, please share your stories, and we will do our best to get them amplified. Thank you.
Thank
Thank you, everybody, for coming so much. We appreciate it. And we'll see you at the next one sometime soon. Bye, everybody.